Major funding for these broadcasts has been provided by grants from New York Community Bank, AmTrust Title Insurance Company, Perfect Building Maintenance, M&T Bank, Customers Bank, Marks Paneth LLP, Ariel Property Advisors, Sterling National Bank, Capital One Bank, Collins Building Services, Meridian Capital Group. Additional support has been provided by grants from AVR Realty Company, Amerant Bank, Bank of America Merrill Lynch, B6 Real Estate Advisors, Briarwood Organization, Chase Commercial Term Lending, Chase Commercial Mortgage, Citizens Bank, CPEX Real Estate Services, Douglaston Development Levine Builders, Flushing Bank, Friedman LLP, Handler Properties LLC, Handler Real Estate, Hodges Ward Elliott INC, Investors Bank, James D. Kuhn Real Estate Center at Syracuse University, Kilroy Architectural Windows, New York's Window Company, Matone Group, New Banks, Newmark Knight Frank, Optimum Window Manufacturing Corp., People's United Bank, Rockefeller Group, Rosewood Realty Services, SJP Properties, Stonehenge NYC, TD Bank, Terra CRG, the Meringor Family Foundation, and these friends. Try to imagine figuring out what you should do about health insurance. It is a nightmare. People have no idea what to do with it. They don't know Medicare, different platinum programs, Obamacare, other coverages. It's scary. So what do? You go to the experts. You go to the people who understand. The people who even have a radio show which airs on Sirius from 12 to 2 on Thursday. So today I've assembled this group of healthcare professionals who are going to talk about analyzing the maze of health insurance. We have 3 vice presidents from the NYU Langone Health, Allison Vogel, Andy Rubin, and Matthew Penzer. So talk to me about your radio show.
It's about 11 years old now. It's on a really interesting and successful channel on Sirius XM, channel 110, called Dr. Radio. And Dr. Radio was conceived by the president of Sirius XM, who is a patient of the NYU Langone Health System. And he thought how great it would be to be able to have doctors on the radio answering. It's a call-in show, or it's a call-in network, having where patients can call in and ask world-class experts their opinion about various topics of healthcare. So as we were putting this show together, I suggested to the Sirius people maybe a show on health insurance because, it might be valuable to a lot of people. Certainly, doctors, people wanting to talk to an orthopedic surgeon about hip replacement's important, but then also finding out if it's going to be covered.
Wait a second. Do you allow the doctors to find out because they want to find out what type of insurance they should have?
It's true. It's true. So it just came together that way, and it's been extraordinarily successful. So every Thursday at 12 noon, the phones light up into the studio, and we spend the next couple of hours talking to patients who need help understanding how to navigate this maze.
Okay, at the university, at the NYU Langone, you're more involved with managed care, you're involved with the entire physicians group, and you're managing the contracts, right? What's the biggest question people have about insurance, what they should have?
It's really been an evolution, actually, because when we first started 11 years ago, we were talking about, people were concerned about how do I get insurance, and people couldn't get insurance. And then there was the whole transition into trying to get Obamacare passed and talking about would it get passed, and then it did get passed, and that was really exciting for us. And now we're in this whole different trajectory of the fear of how to get insurance through Obamacare. Yeah.
How do you get insurance under Obamacare?
Actually, it's really easy. You can go online. That's what's the beauty of that whole program. You can go online and enroll.
What if I screwed up on date?
There's open enrollment. There's a limited window. You have a limited time frame to enroll for insurance. open enrollment, whether it's on the exchange or even through your job, just like we have.
Explain
November
what the
1st.
November
every year-
1st,
Every year.
yeah.
So what's the exchange?
So the exchange is what Obamacare created. It's the easy marketplace to research and buy insurance. It's what Ali was saying.
Yeah.
It really is easy. And when people call us and say, I need insurance, what do I do? We have computers in the
So I
studio
hear
and we're
platinum,
doing it.
I hear
Yep.
platinum, gold, bronze. What's the difference?
So for a patient, to me, I don't know how you guys feel, it somewhat doesn't really matter. It does change if you're going to pay up front through premiums versus behind on deductibles and copays. But what you're getting in terms of benefits that are covered, can I get this covered or that covered? It's all the same no matter what color.
A platinum plan is very simply the same list of benefits, but a higher premium with lower deductibles and cost-sharing payment schedules. So if I am a person who is sicker, older, or more likely to need health care, you want to buy in the range of a gold or platinum plan because your out-of-pocket costs will be less than someone who buys a bronze or silver plan. The bronze and silver plans have lower premiums but higher deductibles. So if you're a younger, healthier person and less likely to end up in the hospital, then a bronze plan will actually save you money because you're going to be spending less on premiums. But remember, it's healthcare. It's all a guess because a young person may get sick.
That's right.
Yep.
You never know.
Now what happens about I have a pre-existing condition?
Well, that's what Allison was
Yeah.
referring to in the pre-Obamacare era. Our show was started with people, half our calls in the beginning, where I live in a state where there are not a lot of protections for people with pre-existing conditions. So one of the underpinnings of healthcare reform, which we affectionately call Obamacare, was to put safeguards in to eliminate pre-existing conditions. And it worked. So you can no longer be denied health insurance, discriminated in getting health insurance, or pay more for health insurance if you have a pre-existing condition. But in full disclosure, because Matt and Ali and we all agree the exchanges, these electronic marketplaces, have been transformational in how people can buy health insurance. It is true, and this has been a huge problem. It was a big problem with President Obama. It is true that depending on where you live in the country, you may have fewer choices than we have here in New York State and New York City, and we may be paying more than we used to pay before the exchanges. So there are pluses and minuses
What
to the
percentage
exchange.
would you say are people who are uninsured, who have no coverages, because of course that limits
Pre and
it.
post? Well,
Today, I'm talking today.
there's multiple ways to answer how many
Right.
people don't have health insurance in this country. So the way we like to answer that question, but I'll answer it however you want, is how many people obtained health insurance who didn't have it prior to Obamacare. And that number is now at about 15 to 17 million people. It was rising every year once it became law. It's been declining since President Trump took over a little bit because of some legislative changes that were made, removing the individual mandate. But in general, a lot of people in this country, 17 million, if the numbers are correct this year, are now getting health insurance that didn't have it in the past. Now, whether that means there are 20, 30, 40 million Americans who still don't have it, it depends on who you're counting in that number. But 17 million people more have it now than used to have it.
What happens to the person's graduating college? Are they covered? Or
Yeah, so they-
is it undergraduate or graduate school also?
So it's really about age now. That's how one of the changes of the law of Obamacare. It's through 25. When you turn 26, you can no longer be on your parents' insurance. So they extended that a little bit. It doesn't matter if you're in school, if you're not in school, through age 25.
So what
you're good.
happens? Someone calls you up and they say, my son and daughter is turning 25. What do you recommend for them?
Do they have the ability to get insurance through their job? If they don't have the ability to get any insurance through a job that they have, they can go on the exchange. If they have limited income and they're in a state that has expanded Medicaid.
Now, I heard
Okay.
before November 1st. What happens? They finish college on June 1st.
Special enrollment.
Yeah, it's called a special enrollment window, as Andrew had said. There are certain periods in your life-changing events that allow you to have a special enrollment window, graduating college, getting married, having a baby. There's all
Getting
these
divorced.
exactly that allow
Death.
you to enroll in insurance at a time that is not open enrollment. That's not November 1st. that you can then go on to the exchange and enroll in insurance.
And what happens about someone who gets divorced?
For many fortunate people in this country, I use the word fortunate, if they're eligible for COBRA, which is a program that predates Obamacare, healthcare reform. That's a program that allows you to stay on your health insurance when you leave your job for up to 18 months. So if you are divorcing your spouse or getting divorced, the individual who is losing their insurance can actually stay on their spouse's insurance plan for up to 36 months. So you actually get 3 years of COBRA in a divorce, whereas the general public who loses their job, it's 18
Now, do you
months.
recommend to people that they should take COBRA?
Well, it depends. I mean, COBRA,
money.
remember, a lot of employers are subsidizing for their employees the cost of health insurance. Under COBRA, there is no more employer subsidy.
Right,
So
and
you
you're paying
pay
the full premium
You pay
now.
the full premium.
But you may be getting a very good health plan.
Right.
Remember, when you go on the exchanges, and this is one of the problems with the exchanges in this country, and it, again, varies by state. So when you're in New York State, we have a lot of protections. Our health insurance markets are very stable. If you go to a state like North Carolina or a state like Oklahoma, you have fewer choices.
I know that the NYU Langone accepts most insurances for everything, but there are certain hospitals in New York or New Jersey who specifically say we don't take coverage. What do you recommend for that?
So we always tell someone when they're signing up on the exchange, and we tell them this with the Medicare Advantage plan as well. You need to make sure, if you are going on an exchange plan, that you look at the physician network and the hospital network that participates with the insurance product. So, you know, we were speaking earlier about this startup company called Oscar. It's a very well thought of insurance company that is now expanding outside of New York to other states. It's a good insurance product. They use a lot of technology.
It's a low-cost alternative for young people.
I wouldn't call it low cost. I would call it a very efficient insurance company that is able to offer premiums that are sometimes lower than what you would find on the traditional exchanges. The way they do that, however, is by narrowing the network of doctors and hospitals you can see. So if you're a consumer, you have to be willing to make that trade-off. You have to say, I'm not going to go to NYU Langone Health for my health care because we're not in the Oscar network. I'm only going to go to Mount Sinai because they are in the Oscar network.
You know, sometimes they change their job. What do you recommend to someone signing up for Part A, Part B, Part C, and Part D in Medicare?
So if you're still working and you're Medicare eligible, if you're in a company that's large that has over 20 employees, then you could stay on your company's insurance and still be Medicare eligible. You stay on your company's insurance, and then once you stop working, then you can enroll in Medicare. You don't have a late enrollment penalty once you stop working. You just notify Medicare at that point, say I've stopped working.
Let's talk about this late enrollment penalty.
Okay.
What is this?
So Medicare basically has figured out that if you don't sign up for Medicare when you're first eligible and you sign up later, you're more likely to have higher health care expenses. So they want to force you to get into the Medicare program when you're first eligible at 65. If you don't, they've put a penalty in. It's 10% of compounding every month. So it becomes pretty significant, and it gets built into your premium forever. So someone that's paying the usual Medicare that's enrolled maybe a year late may pay $50 extra a month for their entire life.
Because they didn't take it.
Because they didn't do
Right
it
away.
right out of the gate. So that's
Okay,
their
what
way
ab-
of
And they have to
securing
wait
it.
for open enrollment. So if
Right.
if you think you can beat the odds and you don't sign up for Medicare and you're willing to pay that penalty when you finally get it, but you're diagnosed early in the year with cancer, you may not be able to wait until open enrollment the next year to get into Medicare. So you're really
But
rolling
when
the
somebody's
dice.
over 65, maybe they've changed their full-time employment, they're an independent
Sure.
individual, what do you recommend to
We
someone?
want to know a little bit about that person.
Right.
So let's talk about that person.
So that person usually falls into two categories. One is if they're still working. What are the insurance benefits they're getting from their employer now? Are they heavily subsidized by the employer? Because remember, employers aren't obligated to provide health insurance. They do voluntarily. So they also control the level of subsidy that they're giving you. So most employers pay a lot of our healthcare dollars. So if you are fortunate to work for that kind of employer, you probably don't need to sign up for Medicare, the traditional program of Medicare, while you're working because your employer is providing you with a very good product at their expense. There is a program that's part of Medicare, Part A, hospital insurance, which is the Medicare program that pays for hospital bills. You don't pay a premium to have that insurance.
But that's only 80% of the hospital bill, correct?
Correct.
Part A?
But you don't pay a premium to have Medicare Part A because it's paid for by payroll taxes that you've paid
Right,
for
you
your whole
paid
working
previously.
period
Right.
and your employer pays. So we always advise people sign up for Part A when you turn 65.
But
even
what
if you
happens
don't
about
sign
my
up.
20%? My 20% could be expensive. What do you recommend now?
If you have private insurance through your employer, because that's who we're still talking about, that person who's still working, your private insurance pays the insurance claim. Medicare is secondary to that.
Okay.
So if you are not working, or we're advising you to take Medicare, we advise people to take Medicare Part B, the doctor bill portion, Part D, prescription drugs, and then this program called Medigap, which picks up the 20% that the Medicare program doesn't cover.
Okay, the Medigap picks up the 20% of the hospital and the 20% of the doctor?
Correct.
Yes.
Correct. Yep.
What happens when you go to somebody and the coverage is denied? Why is it denied traditionally on Medicare?
On Medicare, it really
It really
doesn't get
shouldn't be.
denied that
It
If
often.
they
really
take
shouldn't be.
Medicare, it should
Yep.
be taken. Now, so let's rewind that a little bit. So in the Medicare, it's a federal program, so there are a lot of rules and protections for people in Medicare. There are services that Medicare doesn't cover. Under law,
Such as?
cosmetic procedures
Right.
that you may not even think of as cosmetic because it's critical to how you look and feel about yourself. So you're not just going in for a facelift to look younger, but you have an actual dermatologic problem that you want fixed. If you go to a doctor and it's a non-covered Medicare service and they intend to bill you, you have to be provided with advance notification and a form that you have to sign for them to be able to send you a bill. So the reason we say it doesn't happen that often is because the patient which is supposed to know before they go that Medicare is not going to cover this service.
That's right.
What do you say to somebody who's a middle-class person working in New York, who's a school teacher who may retire? They don't qualify now for Medicare until age 65. What type of coverage can they go for? Do they have to go to the exchange? Or do they
If they're not getting a retiree, school teacher is actually a good example because
Right.
they tend to have, and Allison's parents
Yeah.
are both teachers, so why don't you,
Right. So, I mean, retired teachers, especially in New York, have pretty generous benefits, actually. So, for retiree benefits, they definitely would have coverage. If they have children, they would probably would have to go into the exchange because the children wouldn't fall under their retiree benefits, and depending on their age. And then at that point, depending on income level, in New York State and in most states, depending on someone's income, there's the federal, the child health insurance plan, which is a Medicaid plan that in most states children could fall
why don't
under.
you explain people, what is Medicaid? People hear about Medicaid. What is it?
Okay.
Matt?
Well, so it's meant for low-income individuals as a safety net, and also those with disabilities. I think over the years it's gotten a different stigma, and I think with healthcare reform, hopefully that's changed.
Yeah.
What type of stigma has?
So I think people just thought it was for poor people, right? It was for poor and disabled people, and a lot of people said, I don't want to be on a Medicaid plan. There's a stigma to that, I think is how a lot of
and
people
doctors
felt.
didn't get paid very well under the Medicaid program, so
And today?
finding providers who are willing to take it was difficult.
today there's
it's privately managed.
Right, and there's a lot of the plans that are historical Medicaid plans are now selling their plans on the exchange to anybody who wants it.
Commercial.
Now, what happened, I think, 2 years ago, one of the exchange companies went bankrupt. Let's talk about that.
So that creates a problem. It was a new company, and we all health providers were owed a lot of money, and many were owed a lot of money, and we had to write that off. And in some cases, depending on when you got paid your claim, you had to give back money to the state to settle the dissolution of the insurance company. It doesn't happen. Fortunately, it doesn't happen often.
I know NYU Langone has one of the premier orthopedic institutes in the country. What happens about physical therapy? You always hear today people are getting physical therapy because of sports injuries, because of age, and so on. Does Medicare private insurance cover a lot
It
of
does,
physical
but
therapy?
people get confused because the physical therapy is a referred service. Most people can't just walk into a physical therapist's office and say, I need physical therapy. You have to be referred to get it. And because it's something that you get frequently, you tend to select it based on where you work and live. So you need to make sure when you're referred for physical therapy that you're being referred to an in-network physical therapist. One, so you don't end up with a surprise bill.
Let's explain in-network, out-of-network.
So in-network actually means that doctor has a contract to accept a rate and a patient from an insurance company. There's a pre-negotiated deal, and they're in-network or participating via contract. Out-of-network, they have no deal. They have no arrangement.
And
So
they
if a
can bill
patient
you whatever
shows
they
up,
want to bill you.
They can bill you whatever they want.
Okay, and what if you have Medicare, gap coverage?
Doesn't matter, because if they don't take the insurance, they can bill you whatever they want to bill you. So you need to make sure you're going to a physical therapist that takes the Medicare insurance, and then they'll send Medicare a bill, or you'll submit the bill, you'll get reimbursed, and Medigap will cover the difference.
Okay, with regard to that, okay, we have certain major medical centers in New York. Do all these medical centers or these specialty hospitals accept insurance, or are there certain ones who basically won't accept insurance?
I mean, everyone takes insurance. It's just a matter of being specific of what network within the insurance companies they participate with. Because you say, do you take Blue Cross Blue Shield? Sure, in New York City, everyone's taking Blue Cross Blue Shield now, but within Blue Cross Blue Shield, what network do they take? There's the PPO network, but then there's Pathways.
Let's talk about what the PPO is.
So there's a PPO, there's an HMO.
PPO stands for
Preferred Provider Organization, there's HMO, Health Maintenance Organization.
And what's the difference?
So one's a closed network, one's an open network. So HMO, traditionally, if you have an HMO plan, you have to stay within that network, like we said. You cannot self-refer as a patient. I cannot self-refer and go see a specialist if I want to. I have to go to my primary care physician and then stay within that network and only see the doctors within that Blue Cross Blue Shield HMO network. I cannot
If you go
refer.
outside, you don't
I have
any
no
coverage.
benefits. I have no
but-
coverage.
Okay, United Healthcare has their own HMO too.
Sure, every
Right,
major
every
major
carrier has, okay.
has these type of products.
What is the preferred provider organization?
It's a PPO network where I would have out-of-network benefits, where I can see a doctor. Let's say I have United Healthcare, but I could see a doctor that accepts United Healthcare. If I want to see a doctor that does not have a contract with United Healthcare, I can do that. But but I will have to pay more out of my own pocket
Right,
to do
you
that.
get the basic benefits covered, but
Right.
That's right. They may pick up 20%.
Exactly,
of the bill
but I'll have to
rather than
pay-
the whole bill, and you got to pay the difference.
I'll have to pay
now,
the difference.
you know, many times people call me and say, I have to wait for getting a radiology approved. What's the traditional time it takes to get an appointment today with the insurance networks, okay?
Most
with
should
the
be
electronic
approved,
records?
Most should be approved within 24 hours. The only time you're going to wait is if you're on the margin of what is considered medically necessary. It doesn't mean it's not medically necessary. It just means that because it's a highly utilized service, they want to see information from the provider as to why you need the test. Radiology services are expensive. It's actually a way to control costs in the healthcare system. Mm-hmm. It can be frustrating to the patients. It can be frustrating to the provider who's got to use resources to get that authorization. But the concept actually makes sense in that it's designed to control overutilization, because Allison and I laugh about this all the time. Someone will wake up with a sore arm in the morning and they'll say, I need an MRI of my elbow. And in fact, they really don't. People in our consumer-driven society tend to want to go to the most extreme example of
Right,
test
but
to get it done.
in a similar manner, today we have this preponderance of urgent care centers, and you have virtual urgent care. Mm-hmm. What's covered under insurance with urgent care?
Most insurance
of it,
companies are covering urgent care at this point. Virtual urgent care, with us it's covered, but with many others, again, it depends
What
on
is
the
virtual
relation.
urgent care?
You pull up your iPhone and you have a FaceTime chat with the physician on the other end.
Urgent care is a nice consumer service. It hasn't really saved the healthcare system a lot of money. It's in fact increased the cost of the healthcare system, because in many cases, people who are going to these urgent cares that are throughout the boroughs, they frequently will go to their doctor the next day anyway, or they didn't need to go to the doctor. I'm not saying you shouldn't go to urgent care, but it hasn't actually lowered costs. It's added a step in the process. So it'll be interesting to see how all these urgent care centers, what happens.
What
to them
about
over
people
time.
going to the emergency room?
If you can go to the urgent care center and avoid an emergency room, of course,
Yes,
that's the whole
definitely.
underlying
Yes.
premise. But
Sure.
if you need to go to the emergency room, it's because it's most likely it's because it's something that couldn't be handled in an urgent care center.
Many times people were going directly to therapists, psychiatrists, directly. Today it's being done many times over the urgent care, over the telemedicine.
That's true. We definitely have that service where they're doing these telemedicine psychiatry visits, and that's
And the same thing is being done with dermatology, correct?
Correct.
It's about convenience, right? We're in
Right.
the day of convenience. People rather just pull out their phone and talk to someone. If they think they can get the answer and move on, they will.
Quickly, what is the premium traditionally for someone for Medicare? You know, for the best program, let's say they have Part B.
So the full,
know, and
real
the full
quick, the Part A hospitalization, it's covered. There's no premium. Part B, it's about $140, $150
Yep.
this year for the
Right.
for the typical American, typical New York
But it
City
could
resident.
go up to 300 based
It can
on
go on income up to 300. Part D prescription drugs, they range typically anywhere from $30 a month to $50 to $60 a month. And then Medigap, if you're able to and can afford it, that's the supplemental insurance. That runs anywhere from $150 to $300 a month, depending on the level.
And traditionally, what is it costing an employer for an individual?
So an individual in a robust plan, $12,000 to $14,000 a year for a benefit package, and then what you as the employee pay depends on what the employer is subsidizing.
Okay, so it's 12 to 14,000.
Yep.
For a
And
good plan.
What's it costing somebody who's 25 leaving college?
If they have no job and no income and they live in New York State, it costs them nothing. It's fully subsidized.
Fully subsidized. So here's the key. This is a topic that takes hours and weeks. I mean, you've been doing it for 11 years on your week, and people should listen to SiriusXM, to Doctor Network, and specifically Healthcare
Healthcare Connect.
Connect. I'd like to thank Allison, Andy, and Matthew, and I'll see you next week.